been watching our hospitals handle COVID patients with hardly any capacity issues since this pandemic started. But state leaders are now warning that could soon change if Coloradans don't change their behaviors. Alan Janae checking in on our hospitals tonight for us. And Alan, all across the state, our hospitals are busy and they are starting to fill up.
Well, it's particularly bad in the case of ICU beds in places like Grand Junction and Weld County. North Colorado Medical Center in Greeley, a spokesperson tells us, has been extremely full for 3 weeks. They added more ICU beds. They were filled almost immediately. Now, here in Denver, the situation is a little bit better because there's maybe a little more cushion due to more hospitals. But that's not really the answer. Inside a COVID ward where you don't want to be. Dr. Connie Price is part of the team preparing at Denver Health Medical Center as the latest COVID wave arrives.
This is different because the patients keep coming.
Adding ICU beds is called a surge in hospital lingo.
You can surge with a physical bed as long as you have the hookups, the oxygen. So there's a lot more ability to do that. It really is the staffing that's the hardest part.
Across the state, staffing is a problem. Healthcare workers are in quarantine, many being exposed to COVID outside of work.
And our current figure is estimated at several thousand healthcare workers.
In the spring, Colorado sent healthcare workers to hard-hit areas of the country, hoping the favor might be returned.
It was a great plan, but unfortunately, this is now really a national surge. The resources for Colorado to draw on are limited.
At Denver Health, they've stopped elective procedures that require a hospital bed.
It sounds to me like you're about to open up a new area for COVID patients.
We're expanding by 6 beds. And then by December 1st, about 12 more beds. And we're all tired. A lot of our staff have not taken a vacation since the spring, and they're worried for their patients. They're worried about what's to come.
What's to come, particularly at the end of the year, says Dr. Price. But all of this is just predictions. We do know that hospitals are transferring patients, dozens of them over the past few weeks, and hospitals may be looking to change how some health care is provided. But let's face it, there aren't a lot of additional efficiencies in hospital care these days. And it looks like maybe the people doing the hard work right now will just be doing more of it. In Denver, I'm Alan Janae, covering Colorado First.